Good morning. I would like to welcome you to the presentation on the predictors for one-year outcomes after cardiac rehabilitation in elderly patients, which form part of the EU-CaRE multicenter European cohort study funded by Horizon 2020 of the European Commission. The consortium consisted of medical doctors and researchers from the following cardiac rehabilitation centers: Isala Heart Center in Zwolle, the Netherlands; Bispebjerg Frederiksberg University Hospital, Copenhagen, Denmark; Clínico Universitario de Santiago, Santiago de Compostela, Spain; Assistance Publique Hôpitaux de Paris, France; Azienda Ospedaliera Universitaria di Parma, Italy; Klinicum Ludwigshafen, Germany; Radboud University Nijmegen, the Netherlands; and Inselspital University Hospital, Bern. The study included 1,633 elderly cardiac patients, namely those aged 65 and older from these 8 centers. Patients were included if they volunteered for comprehensive ambulatory or stationary cardiac rehabilitation programs at the participating centers. Measurements of primary outcome peak oxygen consumption during maximal exercise test and secondary outcomes such as systolic blood pressure, body mass index, low-density lipoprotein cholesterol, and glycated hemoglobin in diabetic patients were taken before start of cardiac rehabilitation, at the end of cardiac rehabilitation, and after a 12-month follow-up period. The main predictor for improvement in peak oxygen uptake was presence or absence of open chest surgery, with patients after surgery having lower peak oxygen uptake before start of CR and a higher increase in peak oxygen uptake over the duration of CR. In the surgery patients, lag time between surgery and start of CR was an important predictor, with patients starting very early after surgery, having the lowest peak oxygen uptake and improving the most with CR. Female sex was a further predictor for a smaller increase in peak oxygen uptake, particularly in patients after surgery, as was older age and diabetes mellitus in these patients. In patients without surgery, presence of a previous acute coronary syndrome was the only significant predictor for a lesser improvement of peak oxygen consumption. With regard to achievement of target values for systolic blood pressure, older age was the only negative predictor. Open chest surgery patients were less likely to achieve target values for body mass index and low-density lipoprotein cholesterol. Patients on statins were much more likely to achieve target LDL levels. In diabetic patients, those on insulin were less likely to achieve glycated hemoglobin target values, probably due to more advanced disease. We conclude that despite the fact that the different centers included a wide range of CR durations and number of offered exercise training sessions, neither CR duration nor number of attended training sessions had an effect on any of the measured outcomes. Presence of open chest surgery and timing of enrollment in CR after surgery had a large effect on recovery of peak oxygen consumption. Except for BMI, females tended to have worse outcomes, also when corrected for age and baseline exercise capacity. Thank you for your attention.